So I'm happy to share an update on our vaccine rollout to date. Next slide, please. So Halton Region is currently in phase 2 of the province's 3-phased vaccination plan. This slide shows our vaccine rollout progress since our last update. This month, adults 60 to 65 years of age became eligible to receive vaccine across Halton, along with adults 55 years of age and older at participating pharmacies and at 2 pilot primary care practices. In addition, on April 9th, Indigenous adults 18 years of age and older and 1 immediate household family member who is also 18 years of older or older also became eligible. On April 16th, adults 18 years of age and older with highest risk and high-risk health conditions as identified by the province and one of their caregivers, the first group of essential workers who are 18 plus and cannot work from home, adults 50 years of age and older living in the L9E postal code in Milton, and remaining healthcare workers who live or work in Halton and cannot work from home also became eligible. Next slide, please. Despite the challenges to date regarding vaccine supply and changes in provincial direction, Halton has made great strides in rolling out the COVID vaccine. As of the end of day on April 19th, 148,832 doses of COVID-19 vaccine had been administered in Halton. This includes 120,607 doses administered at community and hospital-based clinics run by Halton Region Public Health, Halton Healthcare, and Joseph Brand Hospital, and 17,000 doses administered by Halton Region Public Health and paramedic mobile teams at a range of settings throughout the region. Additionally, 11,224 doses have been given at pharmacies and physicians' offices in Halton. Information on the age group and residence status of people given these doses, as well as how these doses have been administered over time, can now be found on our vaccinations tab of the dashboard on halton.ca by clicking the Doses Administered in Halton subtab. This information is updated once per day, Monday to Friday. Next slide, please. We have made significant progress, but it is important to remember that vaccine coverage is not yet widespread, with many individuals who have not received any vaccine at all, and those who have mostly only received 1 dose of a vaccine series that requires 2 doses for complete coverage. As of April 19th, 27% of Halton residents have had at least 1 dose, which provides very good protection. But this coverage rate, this percentage ranges widely by age, as shown on the graph on the right. 1 dose uptake is highest amongst residents aged 80 plus, with 85% of these residents having had at least 1 dose, and lowest amongst residents aged 16 to 24, with only about 4% of residents in this age group having had at least 1 dose. It is, for this reason, critical that everyone continue to follow public health measures until we have been able to achieve widespread 2-dose coverage. For now, information on 1-dose uptake among Halton residents can also be found on our vaccination tab of the dashboard at halton.ca. Next slide, please. It is normal for viruses to mutate, and we know these mutations may affect how well the vaccines work. In Ontario right now, the UK variant B117 is the most common right now. Vaccine effectiveness against variants of concern is being carefully monitored. The current vaccines have been shown to provide protection to people against developing severe disease caused by variants of concern. However, research have found that the vaccines may not work as well for reducing mild infection from certain variants. Health Canada continues to monitor the effectiveness of all COVID-19 vaccine, and further research is being done to tailor the vaccines to provide increased protection against variants. In addition, Canada is part of an international collaboration to fast-track the approval of modifications to already approved COVID-19 vaccines, should the mutations at any time make the vaccines less effective. Next slide, please. So as I noted previously, we have brought on a group of newly eligible priority populations that can receive COVID-19 in Halton as of April 16th, and these include adults with the highest risk and high-risk health conditions, along with 1 essential caregiver, the first group of essential workers who cannot work from home, adults 50 years of age and older living in the L9E postal code area in Milton, and remaining healthcare workers who live or work in Halton but cannot work from home. We have communicated this expanded eligibility through a variety of channels. In addition to promoting through Halton Region's website and social media channels, physicians were notified by eFax and asked to notify their patients with eligible health conditions. Group 1 employers and organizations were asked to notify their eligible employees. Adults living in the L9E postal code in Milton received notifications through the town of Milton. And healthcare workers who live or work in Halton but are unable to work from home may be notified through their employer, their professional college, and an eFax from Halton Region. Adults with certain health conditions require a shortened dose interval than the 16 weeks currently being used, and they can now book an appointment online. They will be required to have a form completed by their primary healthcare provider or specialist prior to booking a vaccine appointment. Their designated caregiver can also book an appointment online. However, their vaccine interval is the standard 16 weeks. To confirm eligibility, all individuals in this health condition category will need to verbally attest to being eligible at the time of booking an appointment, as well as provide proof that they live in Halton. It is important to note that we are following provincial direction on this eligibility criteria and are unable to provide exceptions. Next slide, please. As we move through phase 2 of Halton's vaccination plan, vaccine hesitancy is a challenge that we continue to address. Vaccine hesitancy is defined as the delay in acceptance or the refusal of vaccination despite its availability. The reasons for vaccine hesitancy are complex and varied and may include concerns about the safety of vaccines, lack of access to credible information, and limited access to vaccine distribution. Initiatives are underway to help instill vaccine confidence and increase acceptance and uptake. Currently, Halton Region Public Health is actively engaging with many community partners, including advisory committees, action tables, local municipalities, service providers, and health professionals to ensure vaccine information is accessible and encourages vaccination. Next slide, please. So in addition to vaccine hesitancy, we are also beginning to see signs of vaccine preference. With a variety of COVID-19 vaccines available, some individuals may express a preference for one vaccine over the other. This has led to some residents to decline the vaccine offered to them in the hopes of receiving their preferred vaccine or delaying vaccination. We sometimes call this vaccine shopping and can lead to delays in the vaccine rollout and the achievement of community immunity. In Halton, there does seem to be a preference for the Pfizer vaccine, with some reluctance expressed regarding Moderna and AstraZeneca amongst residents. To address this issue, we will continue to educate residents about the safety of all vaccines approved by Health Canada and promote their availability, including at local pharmacies. The Pfizer and Moderna vaccines are currently being provided at Halton community vaccination clinics, and the AstraZeneca is available at 73 pharmacies located throughout Halton for residents aged 40 and above. Messages about vaccine availability and information regarding the safety and efficacy of all 3 of the available COVID-19 vaccines has been disseminated through many communication channels, including social media and our regional website. It is important to remember that all COVID-19 vaccines being provided have been approved by Health Canada and are safe and effective in preventing severe disease, hospitalization, and death. Residents are discouraged from waiting for a particular vaccine and are encouraged to take the first vaccine that is offered to them. Next slide, please. I would like to pass things over to Jane McCaskill, who has a few additional updates related to the vaccine rollout.
Thanks, Joanna. First, I'd just like to take the opportunity to thank Dr. Lobo and Dr. Oda for presenting today, as Dr. McGaney was unavailable to attend today. Dr. Lobo has been responsible for the COVID-19 response, including case and contact management throughout the pandemic. And Dr. Oda has been responsible for the vaccine program in Halton since the beginning of the year. Both have provided exceptional service, and I very much appreciate all the work that both doctors have done in supporting Dr. McGaney. Next slide, please. So as Joanna indicated, Halton's vaccination program continues to be very successful. We're seeing good take-up of vaccination appointments from residents who are eligible, with 85% of 80-year-olds and older receiving at least one dose, 70% of 60 years of age and older receiving at least one dose, and 27% of residents 60 and years of age receiving one dose. Today, I'm going to provide you a brief update on our vaccination clinic appointment planning and provide some context to some of the recent announcements regarding vaccine supply. I'd also just like to note that we continue to get very positive feedback from residents on our vaccination clinics, and I'd like to thank Pat Hewitt, who is the director who's been responsible for clinic operations and doing a fantastic job, as well as all of the other teams that support the clinics out there from a corporate perspective. So much appreciated. The next slide, please. So as Joanna noted in her presentation, there are multiple channels for distribution of vaccine in Halton Region. 81% of vaccinations to date have been provided through our community and hospital clinics. These clinics are designed for high volume throughput and have been operational beginning with the clinic at Halton Healthcare since late December. And that they're going to be the focus of my presentation today. I will just note that our mobile clinics that are staffed with dedicated teams of our paramedics continue to do amazing work delivering vaccines to vulnerable populations. They started with the long-term care and retirement homes. They've moved to other high-risk congregate settings and supportive housing, and including our correctional facilities, and are now moving towards highest risk workplaces. They continue to also work with the LHINs to identify and plan for vaccination of eligible housebound residents who are unable to attend clinics. The pharmacy and primary care channels have been available in Halton more recently. The pharmacy rollout is the responsibility of the province, and Halton Region is not involved, and appointments are booked directly through the pharmacies. For the primary care rollout, the region is responsible for the distribution of vaccine provided by the province specifically for primary care and supporting the physicians with the COVAX technology. We're currently piloting the primary care distribution channel with the very specific physicians' offices, and those offices are contacting their eligible patients directly. We anticipate some increased volumes through both the pharmacy and primary care channels now that AstraZeneca is available for 40 plus as of this week. Next slide, please. This is a bit of a busy slide, and it's really meant more as a visual. One of the keys to success for the Halton vaccination program has been our in-house booking system. The booking system was launched on March the 3rd and has been updated 8 times since then to expand eligible populations and add functionality. All Halton community and hospital clinics are booked through the booking system, which allows us in partnership with the hospitals to tactically manage the rollout of new eligible populations and availability of appointments in alignment with our vaccine inventory management. Continuous enhancement to the booking system has been a 7-day-a-week long hour job for the team responsible, led by Gino Alberino and Gretchen Abelda. And this work has been very, very much appreciated and critical, as I said, to our success. In addition to the expanded populations, a few of the key updates that have been made to the system include the movement of second dose appointments in accordance with provincial direction, which was required early on. We were able to do that through the system and send email notifications of changes and reminders. We added the ability for residents to be able to view their appointments from halton.ca so they can confirm their appointments times self-service. And most recently, the ability for residents to reschedule appointments on halton.ca, again, self-service. In the most recent update, we also shifted calendars for some of our clinics to provide more evening hours, recognizing that more of this population were working residents. The self-service options that we've added over time have greatly assisted in reducing calls to 311. I would like to acknowledge the great job that our 311 staff have done in responding to the large volume of calls, particularly at the time we announce a new eligible population. They've done a great job and have been supported at peak times by staff from across the organization. And next slide, please. Coordinating the availability of appointments for eligible populations and the effective operation of clinics and the availability of vaccine is an ongoing challenge. Dr. Joanna Oda, who presented previously, and Tony Oliveri, who's the acting commissioner of the Strategic Transformation Group, lead the planning section of our vaccine committee and are responsible for this coordination in partnership with our hospitals. The objectives for this group are ensuring that we utilize all vaccine available. For any vaccine that is in the freezer, there are appointments already booked in the short term to utilize that vaccine. That is a constant state. Ensuring there are sufficient appointments available for eligible populations. We try to avoid having no appointments available for eligible populations to the extent possible. This is increasingly challenging as it is difficult to quantify some of those eligible populations, and the groups who are eligible based on the provincial framework are becoming larger. Filling all available appointments is another objective. This will maximizes the throughput and effectively uses clinic resources. Our goal is to have clinics fully booked. This requires careful planning of releases of new eligibilities for vaccine and knowledge of of what vaccine is available for each clinic. We only open appointments in the booking system when there is a reasonable degree of certainty that supply will be available. At all times, we want to avoid having to reschedule appointments. This has been a significant challenge. The challenge, given the lack of vaccine supply and the difficulty in predicting and getting a clear line of sight on what our vaccine supply will be. And next slide. So just to give Council an overview of what we've been planning and updating Council on at a high level is we've been planning to have our community and hospital clinic capacity at about 70 to 100 appointments per day based on planning parameters we were given by the province and projections of future vaccine supply. The total clinic capacity of the 6 community and hospital clinics that are currently open and operating is 5,100 appointments per day. We have 2 additional sites that are available but not yet open to provide the additional capacity up to the 7,200. In April, our clinics have been operating at 3,000 appointments per day based on the supply of vaccine. This is the capacity of the clinics when operating a single 6-hour shift at the community clinics. When more vaccine is available, we will be able to run double shifts at the community clinics to achieve the full 5,100 appointments per day capacity. We are currently booking appointments into May for the eligible populations. There have been recent announcements by the province regarding vaccine supply that make it difficult to predict what supply will be available to Halton in May. To avoid having to cancel appointments, we are currently planning based on there being a reduced supply in the month of May. If supply does decrease, it will require us to temporarily close some of our clinics. Again, we're taking a very conservative approach to avoid overbooking appointments. We are waiting for additional information from the province and we'll be able to open additional appointments once we have confirmation of supply. Next slide, please. Some of the uncertainty regarding supply is related to 3 provincial announcements over the last week or so concerning vaccine supply. The first announcement is the first is that the Moderna shipment that was expected April 19th would be delayed to early May and reduced by 50%. No details are available on future shipments. We have therefore not planned any Moderna clinics beyond the first couple of days of May. When the April 19th shipment is received, we will be able to open a few additional days of appointments. It's not known when additional information will be available regarding the future Moderna shipments. In addition to this, the province is changing its allocation methodology to instead of being all based on per population allocation, they're changing the methodology to 25% being focused on hotspots and 75% on population. The change in allocation methodology will reduce the number of appointments we can offer at the Pfizer clinics and could require the temporary closing of probably just one of our clinics. However, the province has also announced last week that they will be receiving, and this has been confirmed, additional Pfizer in May. It is therefore possible that the additional Pfizer will offset the reduction in appointments currently anticipated, or possibly even provide additional appointments for May. So in summary, the net impact of these announcements on Halton Clinic operations is truly not yet known. We've taken a conservative approach to booking appointments in May to avoid overbooking based on the supply available. Once supply is confirmed, additional appointments will be made available. Also, I'll just note before I move on is that there has also been an indication that the next shipments of AstraZeneca will be delayed, which does not impact our community and hospital clinics at this time, but may impact the pace of the rollout to pharmacy and primary care. I should note the federal government has indicated that despite the delays in vaccine deliveries, there will be sufficient supply for all Canadians. And next slide, please. As I've indicated, we manage and monitor the clinics very closely to ensure that we are meeting our objectives. The chart on this slide is from the region's booking system and shows the number of appointments currently booked in the system by day. We are currently fully booked for all of our clinics outside of the odd cancellation until May the 8th. This is based on the reduced appointment capacity planned in May, given the uncertainty of supply. If additional supply is confirmed, additional appointments will be made available earlier in May. Just to demonstrate the great take-up that we do get from Halton residents, and we've had from Halton residents, when we released the most recent eligible populations that Joanna highlighted, we had 38,000 appointments available in the system. That was last Friday, and currently we have had booked 34,000 of those appointments. So in 5 days, we had 34,000 appointments booked in the system, which is fantastic. So Chair Carr, that's the end of my presentation today, and Dr. Oda, Dr. Lovo, and myself are available for any questions.